Good afternoon. We're back in session, so we're going to turn it over to Mr. Merrill.
Yes, Commissioners, back to your time certains. To finish them up, we're at your 10:30 time certain. There were 4 items associated with the 10:30 slot, and that's F4, G3, F5, and F6. And the common denominator is Gene Early, the Department Director of Healthcare Services, who will present these items. They were actually brought by Commissioner Merman, so I don't know if you want to
Yeah,
start.
I'll just make a few opening remarks. Just want to let you know that there will be 4 separate motions, and Jean is going to make the presentation. This has had overwhelming approval from the Healthcare Advisory Board. This is really exciting. So now we can really go out to the public. There is no gap between Medicaid and our Hillsborough County Healthcare Plan. It is monumental that over the last 25 years that this plan is helping so many disadvantaged and working poor people in our community that can't afford health insurance or can't afford the premiums in affordable health care. As you know, our state did not expand Medicaid, which I was not on that side. I thought we should have. Absolutely.
I'm just kidding.
But, you know, because our state's growing so fast, and our proportion of you know, people that are at low income levels is just so much higher than other states. So it was just going to give us another tool in the toolbox. But he is going to give us the report, and then before we make the motions, Mr. Chair, if you could just refer back to me, and I'll make the motion and a few talking points, and if there's any questions
You
from
have a motion on
anybody.
each one?
Pardon me?
You have a motion on each? on each
There's a
item?
motion for each one.
Okay.
Yes.
Mr. Early.
Yes, sir. I'm Gene Early. I'm the Department Director for Healthcare Services. And this presentation today is sort of to support and to review the recommendations and motions that the board is considering. And I wanted to kind of start out with our long-term strategies, and I wanted to make sure that everybody knows what they are. Hillsborough County Healthcare Plan services the most vulnerable population in Hillsborough County. And basically, we want to improve the client quality of life and longevity. That's our long-term goals. We want to complete the implementation of Phase 2, which was approved by the BOCC. We want to increase access to health care, integrate substance abuse, behavioral health, and social determinants. We want to upgrade the HCP client information system. We want to follow 2 tracks, one for self-sufficiency and the other one for disability for our clients, because some clients can't get to the self-sustaining. We wanted to develop measurable outcomes, and we've been doing that through evidence-based guidelines, satisfaction surveys, metrics, key pros, and other measurements, including public health. We continue to evaluate other reimbursement mechanisms, and we institute innovative and cost-effective programs. And the main thing that we want to always do is ensure that Hillsborough County Healthcare Plan remains self-sustaining. So its importance to the community, it provides a safety net for those workers experiencing economic difficulties or who are unable to temporarily work. It ensures the patient has access to a medical home and primary care. It reduces all the costly emergency room visits, hospital stays, and other costs that would be incurred. It contributes to an essential healthcare workforce support and the creation of high-tech healthcare jobs caring for residents of Hillsborough County, and it serves as the payer of last resort. Its importance, just to sort of just give you an idea, it provides nearly $100 million to the safety net and other for-profit hospitals in 2018 and 2019. It supports hospitals and providers who would otherwise not be paid for the provider services. We contract with 13 hospitals, 31 primary care clinics, and more than 3,000 participating medical specialists, large groups, and a host of ancillary services. We provide $3.5 million to Tampa General Hospital to help support the Level 1 Trauma Center, and we support the other non-mandated mandates such as Baker Act transports, Medicaid, and healthcare pilot programs. So this program started in 1991, and I know that many of you know that. It was established as a medically indigent healthcare plan, and it serves county residents generally ages 18 to 64. And it was initially to qualify with incomes at or below 100% of the poverty level in phase one. It served approximately 13,000 members per month and 19,000 unduplicated members in 2018, and at least 260,000 residents assisted in improving quality of life because of the HCP providers since 2008. And we provide, we believe, both efficient and effective access to comprehensive health care. Phase two was the second part of your Hillsborough County Healthcare Plan, which was approved by the BOCC at the time phase one was done. And we've been working ever since to try to get these programs in place. So now I wanted to kind of give you an update on where we are. They developed an integrated and updated client information. It's online, and we're in the process of doing the portal now. We've reduced our per member per month expenditures to half of that of Medicare. We increased eligibility incrementally, and the last increase you did was below 125% of the FPL. We approved integration of medical, mental health, substance abuse, and social services. And as you guys know, you basically were approved for implementation of the Healthy Living Program and opioid action plan, which address these areas. And finally, we've been doing ongoing satisfaction surveys, HEDIS measurements, DOH healthcare outcomes alignment, and other monitoring medics. So the three before you today eliminate the three strikes policy. It expands the HCHCP member eligibility to 138% of the federal poverty level, and it institutes a one-eye exam per year and frames with lenses or contacts with other, and basically it's a vision benefit. So if you do those, the proposed actions result in an estimated community savings in $3.8 million per year and a cumulative of $18.5 million over 5 years. If you expand the HCP member eligibility to 138%, we believe that that will take $1.4 million in FY19 and a cumulative savings of $14.4 million over 5 years. The institution of the vision coverage, this proposed action we estimate at $1.9 million and a cumulative savings of $10.2 million over 5 years. So the total estimated community cost benefit is basically 3.1, but not directly to the plan, but directly to the community itself. I wanted you to be aware that we did use an actuary, and we basically did key assumptions working with the actuaries. And so they did a very conservative assumptions, and you can see those. If you'd like me to go through them, I can, but you can review them at your leisure. But basically, they're very, very reasonable, very conservative, and we worked with the actuaries to make sure of that. So we also, when we looked at this, we made sure that we had included all of our other ongoing and new initiatives. So they are included in here and in the projections that we did and what we think will happen with the plan and the impact. But as you can see, we have a lot of different things, many of these which you are aware of, and I just wanted you to kind of see that. So the impact of the proposed removal of the three-strike policy. I provided you a report, staff report, and I can go through all of it, but I think that I'll just kind of just say that it's there, and if you want me to speak to anything, I can do it. But basically, we talked about the initial cost of $3.1 million in FY19 with a cumulative impact of $17 million over 5 years, and it adds 551 additional members in FY19, or 585 total over the 5-year period. So then we looked at the impact of the proposed expansion to 138% of the federal poverty level, and the initial cost was $1.7 million for FY19 and a cumulative impact of $29.3 million over 5 years. That means that we would get 289 additional members in FY19 and 1,175 distinct members over the 5-year period. Impact of adding the vision on the HCP, 100% of the membership would be covered for the program and could receive the benefit. The impact is $1.4 million with a cumulative impact of $7.7 million by FY23. So in summary, the policy changes would have a cumulative impact of $54 million through FY 2023. These changes would add a projected 1,760 distinct new members to the HCP. And I'm just going to point out that those are people that can't afford the out-of-pocket expenses, and that's primarily because the executive orders in 2017 basically eliminated their ability to pay for out-of-pocket expenses. So having said that, this will take care of a lot of our working poor that otherwise we would not have been able to do. The projected enrollment growth would go to about 15,812 by FY '23, and the projected fund balance at the end of that FY '23 would be 46.1 million. So we went and vetted all of this through the Hillsborough County Healthcare Plan Board, and we also did it through the Behavioral Health Task Force, and we also did it through the Hillsborough County Management Subcommittees. And I would like to thank at this time Dr. Curran, John Curran. I would also like to thank Dr. Friedman, and I would also like to thank Brad Harriman, who is the chairman of the task force, and especially Commissioner Merman for all of her work in helping us get to these points. But given the savings through the effective and efficient management of the HCP, the HCAB recommended that the Hills County Board of Commissioners approve the following. Approve the removal of the 3 strikes policy for HCP eligibility, increase eligibility for below 125% to the 138%, and provide vision coverage as part of the HCP. These recommendations were supported by the Department of Health, USF, Health College of Public Health, our network providers, and the Healthcare Advisory Board members. And then it was certified by our actuary, who I have here today, just in case, and presented to the HCAB as a financially sound approach. Now, the other thing I wanted to mention here, and I wanted to kind of get this out there so that, and I wanted to also thank Mike Merrill for his help and support, and Carl Harness. And basically, this is with all the actuarial projections, no matter what you do, there are estimates that are always potential impacts beyond the control of these projections. So to be fair, it's helpful to do stress testing of the results to demonstrate limitations and parameters of expanding this further or events beyond the control of this evaluation. So there were 3 that we stress tested. One of them was a decrease in the sales tax. One is an increase in the expenditure levels beyond the estimates, and further expansions to membership or benefits to the plan not included in these estimates. And at this time, I'd like to bring up our actuary, vice president, and partner, Jackie Lee, if she is here. She is. And so what we wanted to do is let you know a little bit about her background in Lewis and Ellis, who are our actuaries. And then we thought we would take you through the stress test to show that we believe this to be sound.
Good afternoon, everyone. My name is Jackie Lee. I work for Lewis and Ellis, which is an actuarial consulting firm in Dallas, Texas. We've been working with Hillsborough County and your healthcare plan since 2014. So I'm happy to finally meet the board that that helps get us this work. As I said, I'm Jackie Lee. I'm a partner at the firm. I've been practicing in health insurance for about 15 years, and I've been with the firm for 10 years. And so this is all pretty familiar to us, doing projections. As Jean indicated, one of the things we wanted to address, and I know this came out of questions out of the initial presentation, was, you know, we've made a bunch of assumptions in here. There's a load of assumptions. What happens if, you know, we're wrong? And what does that mean to the fund and to your to the members themselves? So as Jean said, there were 3 pieces that we looked at. One of the things I want to point out is this assumes that you are going to approve moving to the 138% of the FPL expansion, which means it's kind of at its worst case scenario where it has its biggest membership. So the first one is a decrease in the sales tax revenue, not necessarily the sales tax itself. Over the last 5 years, the sales tax revenue trend has been between 3 and 9%. We have assumed in our initial best estimate that Jean discussed at 4%. We reduced that to 3% in all years, which again has never happened, but would be a worst case scenario. And that would end up costing in the first year $1.2 million. And then accumulating all the way up to that, over that 5-year time frame, $20 million. And if you recall a couple slides back, you're sitting at about 45 to 50 million in the fund balance. You would take off this $20 million and still have additional funds. I kept all of them isolated, so now we're back to the original assumption of the 4% trend or in the sales tax revenue, and we're focusing solely on medical expenditures. One of the things I wanted to point out to you is that we have estimates in here for the medical plan expenditure trends. Over the last 5 years, we have seen these trends be negative and go all the way up to 9% in 1 year. So the lowest it has been was a -5% in 1 year, and that is even despite some of the increase in enrollment and eligibility over that time. So our initial estimate was 4% in all years. We did that to match the sales tax revenue trend and to pull it up to what would be kind of considered a more normal Medicaid trend assumption. But again, this is higher than the 3-year average over your expenditures, which was 1%, and that's also the same for the 5-year average. So to stress this, we took kind of the worst trends that you've seen over that 5-year time period and used 9% in the first year, 7%, and then 5% thereafter. And that would end up costing what's in the green there, which is $4.2 million in the first fiscal year, accumulating up to $42 million. This obviously gets us much closer to zero when you think back to the $45 million, but it still keeps you above that amount, and I would consider this a very worst case scenario. Finally, we looked at membership. One of the things we've talked about with Gene and his team extensively is one of the most expensive things you can do is increase your membership, because on average your members cost about $5,500 to $6,000 per year per member. So as you add more of those members on, that's a large dollar amount. What we have shown you here is the membership that's increasing. So if we're at status quo and we're at the 125 million, your membership is going from 14,000 up to 15,644. If you're expanding up to 138, then it's going to grow to 17,000, and that's with an additional 1% trend over that time frame. So we're making sure that we're really ramping up these numbers. And then the final line is taking it up to the 138, but then in each year, fiscal year 20, moving on, we actually increased it 4% on top of that. For reference, your typical membership trend has averaged around 1% per year, so this is obviously well in excess of what you have seen. And you can see below, again, the costs. So as the worst case scenario, the excess of the 4%, it would cost you $32 million, again, which would not take you below that $45 million that you're sitting at right now for the fund balance. Again, not the best case scenarios, but these are kind of to gauge the sensitivity of the assumptions that we're talking about. Are there any questions on the projections that we perform before Gene comes back up?
You want to question her? Okay.
Okay.
Did you want to? Okay, Commissioner Overman, you recognize.
Thank you for your analysis. I love
Hi.
actuaries. I
Oh,
think you guys are
we love you
awesome.
back. That's great. Thank you.
I know, I'm weird that way. I do appreciate the work you went into it. And the one question I had was in the increased expenditure, the increase of 4%. My experience in financial planning is that the cost of healthcare was significantly higher than 4%. Yes. Is that 4% of what we have increased in spending, or how did you get the 4%? Because
The 4%,
historically it's been higher than that.
historically, in general, medical expenses trend at a much higher rate, usually between the 7 to 8 range. Medicaid can be a little bit lower, mainly because it's just a little bit of a different group, so it can be in the 5 to 6. Yours has historically been lower, and this is based on your experience on the health plan. We have 5 years of experience. It's fairly credible, so we've been relying on it, but your medical plan expenditures trend has been -4, 9, 7, so that's more in the normal range, and then -5 and -1 in the last 2 fiscal years. So on average, if you just take an average over 3 years, that's 1%. If you take an average over the 5 years, it's also 1%. So we went with 4 because it was higher, because we didn't want to project a negative trend because that doesn't seem realistic at all. 1% didn't either, and so we went with 4. And historically, as you can see, we've usually used 4, and we've been high because the last 2 years have been negative. So that would be how we came up with it. I absolutely agree with you, but your cohort is not exhibiting the same behaviors as traditional medical health trend. And I prefer to rely on the population I'm looking at, but again, that was to the point of, I did do the stress test to increase it, and I think I did 975 all the way. And it did stress it, but it still didn't take it below. So even if you start to actually experience real trends in a consistent manner, I still don't, at this point, see over the 5-year time horizon of it being detrimental to the plan and its surplus.
Right. My only concern is, you know, if we've kept our expense in the average of 4 in terms of growth, is that a function of, well, finding out that we're about to run out of what our annual budget is, so we're not suggesting anybody take advantage of the benefit? I'm trying to figure out what's market price movement versus program management, and how we've managed that process. So
That part, I guess I'll try to answer for you, if that's okay.
Mr. Early,
One of the,
microphone.
I'm sorry.
Thank you.
We have a unique population for one. We're not the Medicaid is basically a healthy population. They basically have the children and the families and some disability adults. So we're really quite different. And the only place you find that is in maybe some of the expanded Medicaid programs. And that population hasn't been around long enough for us to evaluate. We also have some very unique things because we're an indigent program. So as an example, you saved $20 million last year for medical expenses that the rest of the world had. And so through that process, we're able to lower this through programmatic things. So every year we save about $20 million in medical drug costs. And basically through that process, the way that we've been doing it has worked really well. Secondly, our population reacts a little differently, but if you look at your per member per month for Medicare, for example, I think it's around 9,000, something like that. Ours is 400 and I think it's 480, and it doesn't come out. It comes out around 5,000, and we're half of any of the disability ones that are basically done in Medicaid. So the answers are that we basically have controlled those costs through a healthcare advisory board, through our management committees and others. And we've been able to really get a good understanding of this population because we have databases that go back to 2002. And we have all of the different data elements, like we have all the drug costs, we have all of the fee for service, all the claims data, all of that, and we're able to really pull it up.
okay.
Is that helpful?
No, that's exactly what I needed to know. This program, with a lot of other effort, was put together by my mentor as a government leader.
Wonderful one.
Phyllis Vujansky, got me in this gig, whether she wanted it or not. And so I really appreciate that you bring this forward and provide us with enough information so that we can make the right decision.
And we
Thank you.
wanted to do that, so
Thank
thank
you.
you. So I'll turn it back over to Commissioner Merman.
Commissioner Berman, you recognize.
Thank you, Mr. Chair. And so I'll make the first motion to accept the report that he just presented.
There's a motion by Commissioner Merman, second by Commissioner Kemp and Commissioner Smith to accept the report. Seeing no further discussion, please record your vote.
Motion carries 7-0.
Commissioner Merman.
Thank you. And then my next motion will be to successfully, enthusiastically remove the three strikes policy from the eligibility process for the Hillsborough County Healthcare Plan.
This is G3, a motion by Commissioner Merman, second by Commissioner Kemp, to eliminate the three-strike policy. Thank goodness. See no further discussion, please record your vote.
Motion carries 7-0.
Commissioner Merman.
Then this motion will approve the expansion of eligibility from below 125% of the federal poverty level to 138% of the federal poverty guidelines for the Hillsborough County Healthcare Plan. That's item F5.
Do you have a presentation?
No, sir, I think I've presided everything
He
I can
covered
provide.
So we have a motion by Commissioner Merman, second by Commissioner Kemp, to approve item F5. See no further discussion, please record your vote.
Motion carries 7-0.
Mr. Merman.
Thank you. And then this motion will be to approve the addition of vision services as a covered benefit for the Hillsborough County Healthcare Plan. That's item F6.
There's a motion by Commissioner Merman, second by Commissioner Kemp and Commissioner Overman to approve item F6. See no further discussion, please record your vote.
Motion carries 7-0.
Mr. Gene E. Early Jr.
That's the first time I've ever used that. That's right.
I saw that.
Did a
I had
good
to do it.
job.
Thank you very much. Job well done.
Thank you,
very
and thank you for the support. We appreciate it.
much. Mr. Merman, job well done also.
Thank you.
very much.
Thank you. It's important.
Mr. Merrill.
Okay, that takes you to 1045 F2, Commissioner Hagan's item.
Commissioner Hagan, you recognized.
Thank you, Mr. Chair. Commissioners, if you recall, I first introduced this item in August of last year for Commissioners Oberman and Smith. This issue involves domestic violence victims who have animals. Last year, I was approached by a woman who had been a victim of domestic violence and for years would not leave her tormentor for fear that her pet would either be hurt or left unprotected. She explained to me that unfortunately her situation is not uncommon and that to her knowledge there did not exist a program or service that fosters pets of abuse victims. We did some research and found that this woman is not alone. To most animal lovers, the thought of abandoning their pet is incomprehensible. While feeling even more trapped, many times the abuse victim will continue to expose themselves to further physical, emotional, and psychological cruelty for the sake of their animals. In the past, the Spring had worked with a local nonprofit to foster animals that arrive with their owners seeking to escape abuse. However, this provider was no longer able to assist anymore. And in addition to that, many times there's an issue with medical care even before an animal can be boarded. So in August, the board appropriated $25,000, and we asked staff to work with my office to bring back a program that addresses this issue. PRS collaborated with the Humane Society and the Crisis Center to create a program called DAPS, Domestic Abuse Pet Sheltering Program. It is essentially a partnership that formulates a process by which safe and secure fostering can be arranged with minimal county government involvement in order to protect the victim. How this will work is when the Spring is contacted by a victim, they assess the needs of the survivor. When a pet is a part of the situation, the first option is to see if a family or friend, or family member of the victim can care for the animal. If the private arrangements can't be made, then the Spring will call the Humane Society to take the pet and place it in a prearranged volunteer foster home. When the need for foster care is sudden and is after hours, 7 p.m. to 7 a.m., then Pet Resource Services will pick the animal up and keep it safe indoors overnight. The Humane Society will relieve PRS of the animal the next morning and place it with one of their fostering households. Some veterinary services, especially emergency trauma care, will be rendered via PRS. And other basic medical needs will be managed through the Humane Society. Pet Resources will dispense the money set aside by the board primarily to the Humane Society and some to the spring to defray some startup costs and to minimize the financial impact this new service might place on the nonprofits' funds, thereby hampering the achievement of their original mission. Humane Society will be the primary resource for their foster service, and PRS will assist with backup and emergency services as well as oversight for the disbursement of county funds. I want to thank my legislative aide, Rich Reedy, for all of his work on this program. He really put a lot of time and effort into it. I have two motions to make. The first one is to move approval of the domestic abuse pet sheltering program.
Now, motion by Commissioner Hagan, second by Commissioner White, and I think it was Commissioner Merman. Any further discussion on the motion? Seeing none, please record your vote.
Motion carries 7-0.
And the second motion is during our due diligence in the planning process, it was uncovered that there is virtually no protection for family pets under Florida's domestic violence laws. The exception is the justification for issuance of an order of protection, which is the intentional injury or death on a family pet. All parties that were involved in putting this program together encourage the county to use our influence to include in state law some basic protections to stop the use of a family pet to perpetuate physical, emotional, and psychological dominance in cases of domestic abuse. Brandon is here if there are any questions, but my second motion would be to authorize adding to our state legislative agenda the empowering of Florida's courts to include the welfare of a family pet when contemplating rulings of protection.
There's a motion by Commissioner Hagan, second by Commissioner White. Seeing no further discussion, please record your vote.
Motion carries 7-0.
Thank you, board members.
Thank you, Mr. Commissioner Hagan. Mr. Merrill.
That concludes your time certain, so we'll go to the regular agenda, beginning with B2, which is an economic development item.
Good afternoon, Commissioners. Yaksha Petrovich, Economic Development Department. On January 2nd, 2019, JVS Land Holding Company, LLC, submitted an application requesting that Hillsborough County designate the parcel which is located west of the intersection of Hoover Boulevard and Northwest Hannah Avenue, Tampa, as a brownfield area. The property consists of approximately 19.41 acres and is shown on the projected map. Florida statutes require public announcement of the community meeting and 2 public hearings to designate a brownfield. The proposed community meeting is set to be on February 14th, 2019 at 6 p.m. at AP Lido High School, located at 4409 West Sly Avenue, Tampa, Florida, 33614. The 2 proposed public hearings are set to be on March 6th, 2019 and April 3rd, 2019 at 10 a.m. during the Board of County Commissioners regular meeting in Hillsborough County Board of County Commissioners boardroom on 2nd floor of Frederick B. Carl County Center at 601 East Kennedy Boulevard, Tampa, Florida, 33602. Staff recommendation is to authorize setting a community meeting and 2 public hearings as proposed. Staff is also requesting a waiver of statutory requirement that one of the public hearings be held after 5 p.m. The advertised community meeting will be held at 6 p.m. and the BOCC will be provided with full transcripts of public comment at the community meeting. At this time, I'd be happy to answer any questions you may have.
Commissioner,
Second.
a motion by Commissioner Merman, second by Commissioner Overman. Commissioner White, you recognize.
This is going to sound kind of silly, but I think it's a legitimate concern. I don't know that 6 p.m. on Valentine's Day is a great day or a great day and time to hold a public meeting.
Good point.
It could, I mean,
Depends.
I knew that would get some chuckles, but it could impact your participation though. Is it too late to consider a different date or?
We would need to check with the school what's available. We're kind of trying to squeeze it between the 2 meetings, so that kind of fell as like the day 2 that we picked. I mean,
I'm legitimately concerned that can impact your participation. Look, I mean, I'll vote in favor of the motion on the floor, but I don't know what that would mean in terms of maybe trying to find a different date.
Historically, we haven't had much participation in these. The other two parcels that we designated over the last few months, just to the north, had no public turnout for either of those community meetings or the public hearings. So I mean, I think your
You know-
point is legitimate. It might impact it, but
You know, I'm a big proponent of public engagement on stuff like this. So, I'm not gonna beat this horse to death, but, I would just ask staff to just think about, dynamics like that as we're setting these dates and whatnot, so.
Commissioner Merman, you recognize.
I think Commissioner White, you should be commended as a man to take Valentine's Day so seriously.
See that?
And I do appreciate it. You're probably one of the few. But,
Yo,
gonna-
whoa.
see, I knew. We'll find out who's it.
I'm gonna request a thumb drive to this and take it home to Mrs. White. and show it to her.
Yes, ma'am.
Is there any other avenue for citizen input into this, online or email or anything besides that?
I mean, they have, the sign is posted with contact information, so they could reach out either to us or the developer. Also, there will be 2 public hearings at the board meetings, so they could have input in March and April during the regular BOCC meeting,
That's-
public hearing.
That's good to know. I do think that's a fair point and something that we should consider moving forward.
Commissioner Overman, you recognize.
So, if someone would like to make comment, and unable to attend on February 14th, who should they contact? What email address should they reach?
They can always reach out to me. There is also an email and a phone number that will be on the sign for it'll be published in the paper, and it'll be a posted sign on the property.
Can you provide that information
Sure.
now?
Yeah, they could email me. It's Petrovic J, so it's PETROVICJ@hillsboroughcounty.org.
Outstanding. Thank you very much.
No problem.
Commissioner White, you recognize.
And I'll just close by saying, Mr. Merrill, in the future, let your staff spend the evening with their Valentine.
I knew somehow I'd be painted as the Grinch, so. Okay, yes, I will attempt to do that.
At least buy some chocolates or something. You have a motion by Commissioner Merman, second by Commissioner Overman to approve item B2. Seeing no further discussion, please record your vote.
Motion carried 7-0.
Mr. Merrill.
Healthcare services B4.
Gene E. Early Jr.
I will never live that down.
No, you won't.
What does the E stand for?
Huh?
What does the E stand
I
for?
will not tell you.
Ever? Ever early?
Ever early.
That's cold. All
Sorry.
right, so B4 is basically an agreement with the Crisis Center of Tampa Bay, Inc. and budget amendment. It approves the agreement with the Crisis Center for the provision of emergency stopgap funding from the county to ensure the continuation of VOCA-funded program providing services to crime victims during the partial federal government shutdown and the associated budget amendment. The agreement states that monthly invoices to the county shall not exceed $157,659.33, which is 1/12 of the annual federal VOCA grant amount of $1,891,912. And 2, this part is important, the Crisis Center shall immediately repay the county for many monthly invoice payments upon the Crisis Center's receipt of funds for the month associated with the county's payment. And in any case, the Crisis Center shall repay the county all amounts paid by the county no later than September 30th, 2019. Additionally, approved by supermajority vote in accordance with Board Policy 3.02.05.00, reserve for contingency, a budget amendment appropriating $1,891,912 from the countywide general fund reserve for contingency.
Move approval.
The budget,
We have a motion by Commissioner Hagan, second by Commissioner Overman to approve.
Not gonna let me read the rest of it, are
B4. Seeing no further discussion, please record your vote.
Motion carries 7-0.
Thank you.
Mr. Merrill.
Procurement services, B6 through B10.
Good afternoon, Scott Storm Procurement Services. Item B6 is asking the board to approve and execute a fifth modification to an agreement with Advanced Data Processing Incorporated, increasing the amount by $640,000 from $4,116,509 to $4,756,509 and other related changes related to ongoing automated medical billing and collection services associated with emergency transportation of patients by fire rescue. In this case, there are no subcontracting opportunities for disadvantaged business enterprise firms, as the subject services will continue to be provided directly and exclusively by the existing contractor. Procurement Services recommends approval.
Before you approve it, I just wanted Chief Jones to just take a minute to assure the board and the public that they should accept ambulance rides when they need it, and ability to pay is not a consideration, so.
And I'll second Commissioner Murphy's motion.
Okay, we have a motion by Commissioner Merriman, second by Commissioner White. Chief Jones, good afternoon.
Yeah, I plan to spend the next Thursday evening with my wife. Valentine's Day. I wanted to just make sure it was clear. We only collect about 4% of all of the collections on ambulance transports from individuals. The other 96% comes from Medicare, Medicaid, and other insurance companies. And when we arrive on scene of an emergency, the decision to transport has nothing to do with the ability to pay. It has to do with the patient's need to be transported, and it's not a factor. It's not a factor of their ability to pay. Just want to make that clear.
All right. Commissioner Merriman, you recognize.
Thank you, Mr. Chair. It's a quick question, and it's not really related to this item, but one of the mayoral candidates made a statement to the public that the transport vehicles that the city uses or they contract with, I guess it's one of those companies, has like over 250,000 miles, and vehicles are breaking down to get to people, and sometimes people have died because they haven't gotten there, or they broken down after they picked them up. And it would never be a problem with us.
I saw that report, and I can assure you in Hillsborough County, our vehicle fleet, our ambulances, average life is about 2.5 years old, and the mileage is under 100,000. We have a very aggressive fleet replacement program, and we do good maintenance on the vehicles, and it's a very young fleet for ambulances. We don't have that problem in Hillsborough County.
Maybe you should help out the city.
You did at one
Kemp, you
point.
recognized.
We have.
Chief Jones, I just wanted to know, is it part of the protocol or training that, as unfortunate as what occurred did, that attendants are trained to, if someone asks them about the cost, to answer in that manner that, that is not part of any consideration, or that, they're not subject to something that if they cannot afford to pay for it?
Yes, ma'am. The training is that the treatment is based on the need for treatment, not on the ability to pay. If a person insists and asks the question, we will give them factual information. But again, the request or the need for treatment is what drives the treatment, and not the ability to pay.
I just wanted to make sure that if it comes again, that the answer, that the person at the scene that's calling, or the one that's with them, understands that clearly.
Yes, ma'am, and we have reiterated that department-wide.
Thank you.
Thank you, Chief Jones.
Thank you.
We have a motion by Commissioner Merriman, second by Commissioner White to approve item B6. Seeing no further discussion, please record your vote.
Motion carries 7-0.
Continuing, item B7, asking the board to select, approve, and execute 2-year agreements with Advanced Environmental Technologies LLC, GHD Services Incorporated, and OHC Environmental Engineering for ongoing and as-needed miscellaneous professional asbestos remediation and environmental engineering services for real estate and facilities in the amount of $500,000 each, for a total over the 2 years of $1.5 million. In this case, the opportunity to propose for proposers to receive 5 bonus points for a subcontracted minimum of 10% of their fees was made available, and 15 of the proposers, including those that are recommended, took advantage of those points. Procurement Services does recommend approval.
Motion by Commissioner Merriman,
Second.
second by Commissioner White to approve item B7. See no further discussion, please record your vote.
Motion carries 7-0.
Item B8 is asking the board to award and execute an agreement with the lowest responsible bidder, Air Mechanical and Service Corporation, the amount of $2,090,240 for expansion of the existing chiller plant on the Falkenborg Jail campus for the Real Estate and Facilities Department. A disadvantaged business enterprise goal of 8% was established, and the recommended vendor has committed to achieving a higher goal of 12%. Procurement Services recommends approval.
Motion by Commissioner Merman, second by Commissioner Kemp to approve item B8. See no further discussion. Please record your vote.
Motion carries 7-0.
Item B9 is asking the board to select, approve, and execute two-year agreements with Anston Greeley's Incorporated and KPI Engineering Incorporated for ongoing and as-needed miscellaneous professional electrical and mechanical engineering services for real estate and facilities in the amount of $500,000 each for $1 million total over the 2 years. The project is a set-aside for registered Hillsborough County business enterprises. Therefore, no disadvantaged business enterprise participation goal was established. Procurement Services recommends approval.
Motion by Commissioner Merman, second by Commissioner Kemp to approve item B9. See no further discussion. Please record your vote.
Motion carries 7-0.
Lastly, item B10 is asking the board to award a 4-year contract to the overall lowest responsible bidder for all groups, JSM Services Incorporated, for ongoing and as-needed chemical application and turf maintenance services at athletic fields throughout the county at a total estimated cost of $7,139,450 for the Parks and Recreation Department. In this case, no participation goal or set-aside was established for the procurement. However, all disadvantaged business enterprises and registered small business enterprises were solicited in this category. Procurement Services does recommend approval.
Motion by Commissioner Merman, second by Commissioner Kemp to approve item B10. See
I
no
think
further-
we should give an award for quick
Pardon?
reading.
Pardon?
I said special recognition for quick reading.
Oh, quick. Okay. All right. See no further discussion. Please record your vote.
Motion carries 7-0.
Thank you.
Thanks,
Mr.
Scott. B11, Public Utilities.
Wish Scott could do mine. George Cassidy, Public Utilities. Good afternoon, Commissioners. Item B11, we're requesting approval of a 7-year sole source contract with Oracle America in the amount of $8,041,754.88 for the purchase of the Oracle Customer Care and Billing System, which is basically an upgrade and replacement of our current billing system. A notice of intent to sole source was properly advertised and no challenges were received. There are no subcontracting opportunities for certified disadvantaged minority or disadvantaged women enterprise firms, as all the services will be provided by the vendor. The initial funding of this project of $4.5 million for the initial purchase is within the current operating budget for public utilities, and subsequent funding will be budgeted as necessary for ongoing services. Staff recommends approval.
Motion by Commissioner Merman, second by Commissioner Kemp to approve item B11. See no further discussion. Please record your vote.
Motion carries 7-0.
Mr. Merrill.
Item F1, Board Appointments.
We have several boards today. Your first board is your Affordable Housing Advisory Board. Please choose one. Commissioner Miller,
Number 1.
Commissioner Kemp, Commissioner White,
Number 2.
Commissioner Merman,
2.
Commissioner Hagan,
1.
Commissioner Smith,
1.
Commissioner Overman.
1.
Be Connie Burton. Your next board is your Code Enforcement Board. We have 3 members and 1 alternate. Commissioner Miller, choose 4.
You want my members and an alternate, right?
Yes,
Okay.
yes, give me your alternate last.
My members are 6, 7, and 9. My alternate is 4.
Commissioner Kemp.
My members are 3, 4, and 6, and I is the alternate 9.
As my members, I choose 3, 6, and 9, and I choose 4 as my alternate.
Commissioner Merman,
3, 6, 9, and 4 is the alternate.
Commissioner Hagan,
Same.
Commissioner Smith,
3, 4, 6, with 9 as the alternate.
Commissioner Overman,
5, 6, 9, with 4 as the alternate.
so the alternate will be Denise Boyd. Sharon Clayton, Anthony Bordenero, and Michael Bolin will be the members. Your next board is your Code Enforcement Board. There's 2 openings.
There's 2 openings, you don't have 2 names.
Oh, right. That, I think we should just re-advertise. That was one of the persons that is on here, Philip McDonald. He recommended that we re-advertise the position.
I would concur, and
So I'll make a motion to do that.
We have a
I'll second
motion We have a motion to re-advertise code enforcement special magistrate by Commissioner Merman, was seconded by Commissioner White, and I think Commissioner Overman.
I have a comment.
Commissioner White, you recognize?
I just want to say for the record, in his defense, he's evidently an airline pilot,
Right,
and
yeah.
that's created some
Right.
issues for him, so.
Okay, we have a motion to re-advertise code enforcement special magistrate. Is there any further discussion? Please record your vote.
Motion carries 7-0.
Your next board is your Hospital Authority. Please choose one. Commissioner Miller,
Number 12.
Commissioner Kemp, can go Commissioner White,
14,
Commissioner Merman,
12.
Commissioner Hagan, Commissioner Smith,
12.
Commissioner Overman,
There you go. 12.
and Commissioner Kemp. It will be Bryce Bowden. Your next board is your Human Relations Board. Choose any 5. They're listed in the categories they represent, but you can choose any of the members. Commissioner Miller,
19, 20, 21, 22, 23.
Commissioner Kemp,
19, 20, 21, 22, 23.
Commissioner White,
19, 8, 20, 21, and 23.
Commissioner Merman,
19, 20, 21, 22, 23.
Commissioner Hagan,
19, 8, 20, 21, and 23.
Commissioner Smith,
19, 8, 20, 22, 23.
Commissioner Overman,
19, 20, 21, 22, and 23.
it will be Scott Lewis, Avelino Vide, Shannon Romine, Sele Gordon, and Matt Newton. The next board is the Industrial Development Board. There are 2 openings. Both of these can be appointed. Calvin Cyrus had actually applied to other boards, and since he wasn't appointed, both of these members can be appointed, and Mr. Morrison has recommended both of them. So he'll be reappointed or appointed. And your last board is Taurus Development Council. There's one in each category. Mr. Bartholomew was the only one eligible for the hotel motel industry rep, so he will be appointed. And please choose one, Commissioner Miller, for the tourism development rep.
Number 28.
Commissioner Kemp,
28.
Commissioner White,
28.
Commissioner Merman. 28. Commissioner Hagan,
Same.
Commissioner Smith. 28. Commissioner Overman. Michael Worrell will be reappointed. And then the Housing Finance Authority has been deferred to the next board meeting, February 20th.
Second.
I have a motion to confirm the appointments by Commissioner Merman, seconded by Commissioner White. Seeing no further discussion, please record your vote.
Motion carries 7-0.
F8, Commissioner White's item.
Mr. White, you recognize.
Thank you, Mr. Chairman. You know, I'm a parent of a middle school age child. He's actually my third and final child going through middle school, just finishing up as an 8th grader. My two oldest daughters are in high school and college now, but, you know, saw them through middle school as well, obviously. And in seeing the news footage recently and hearing from some parents about raising funds privately to provide for crossing guards to local middle school, and then seeing that a middle school was following suit and attempting to do the same, you know, that caught my attention, and it really resonated with me. I've seen a lot of near misses with my own two eyes, you know, as a parent at our local middle school. I've heard a lot from parents from various middle schools across my district in my time as a commissioner. And, you know, I'll say there was likely a time when one could argue that middle school crossing guards were not necessary. But today, our streets are more congested. Drivers seem more likely than ever to do things like speed through school zones and drive distracted by things like cell phones. And by the same token, middle school students are as young as the 6th grade. Younger middle school students in particular are at an age where they're still likely to struggle with things like judging the speed and distance of an approaching vehicle. And these students are also likely to be distracted themselves with devices or having earbuds in or what have you. Middle school parents are beginning to take matters into their own hands, as I mentioned, and seeing this news footage and hearing about it and raising this money. But I feel that we have an obligation to provide crossing guards administered by the sheriff's office, just like we do for our elementary schools. Sheriff Chronister has graciously joined me in advocating for this. And since scheduling my item, I've learned that the sheriff has already started the process of studying the feasibility of providing crossing guard services to our middle schools. So with that being said, my motion today would be to direct staff to A, formally join and provide necessary resources towards the sheriff's office's study of the feasibility of providing crossing guard services to all traditional public middle schools in Hillsborough County, and B, to identify potential funding sources for implementing the program.
There's a motion by Commissioner White.
Second.
Seconded by Commissioner Smith. Commissioner Overman, you recognize.
Thank you, Kurt. I think, you know, a very large population within our community is very concerned about the condition of our children needing to just get to school safely. I live next to a middle school. It's quite fascinating what happens after 3 o'clock. It literally looks like a war zone with cars and people running everywhere when the school lets out. And what we heard earlier today was a good indication of people's, you know, concern about our children trying to get to school safely. However, just getting crossing guards is not going to solve the problem. As we heard earlier, if you don't have a crosswalk, you can't put a crossing guard there. So I'd like to suggest an amendment to your motion to consider, if that's the right protocol. I'm still learning this process, but that we also ask staff to identify those intersections that don't have crosswalks that would require or be recommended for crossing guards. Because we are going to have schools that may not have crosswalks that need crossing guards. And since you can't have a crossing guard if you don't have a crosswalk, we're only addressing half the problem possibly in many cases, and especially out in our rural areas.
I'm going to second that motion for the sake of clarity, and I've requested the floor when you're finished to add some comments to that.
Thank you very much, that's all.
Okay, we have an amendment to the motion by Commissioner Overman, second by Commissioner White. Commissioner Smith, you recognize.
Thank you, and thank you for bringing this forward. This is certainly something we all recognize the need for. Our community is among the most dangerous in the country for pedestrians of all ages, but certainly a priority has to be our school children getting to school and getting home. And so that I think is the priority in making it safer. We've all been hearing from parents of school children. I know my office has as well, and the comments made by the parents today were very compelling, and they really done their homework on this issue and understood the need of it. But one comment especially moved me this morning, and it was, let's don't look back on this day and regret not taking this action. So certainly I'll be supporting this, and thank you for bringing it forward.
Commissioner Kemp, you recognize.
Thank you. I want to thank you, Commissioner White, for bringing this forward. I have some other related motions once this is done. I saw the reports on ABC News 10, and I thought they were utterly bone-chilling. I mean, I just thought it was so reprehensible. And so I think this is a great start on where we go. And I was amazed to learn that there already wasn't cross guards for middle school students. I just, I thought, how could that be? So this is a move in the right direction, and thank you for bringing it forward.
Commissioner White, did you want to go last?
No, I can go now. Yeah.
Okay,
No, I was just going to say that my understanding is that this feasibility study will include a look at capital and infrastructure needs like signs, crosswalks, things like that. However, we can never have enough clarity, which is why I gladly seconded your motion and will be supporting that as an amendment.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. And I am very supportive of this. I actually have many problems with some middle schools and sidewalk issues. As you know, Big Bend Road was one, a huge one, that they're getting ready to fix that. And they have hot spots where they have addressed issues. We have a big one up at West Chase at Countryway Boulevard where we have added crossing guards while they put it with the crosswalks. So I think to look at this holistically is very good. But I do want to commend our staff because they have been very responsive when we've needed to get answers for danger zones out in the county. And we have quite a few, and we know we have more to do. But staff has, from my standpoint, my office, they've been very, very responsive and helpful. But I do think we have to address this holistically, and that's why I'm glad it's here today. Thank you.
Okay. We have an amendment to the motion by Commissioner Overman, second by Commissioner White. Seeing no further discussion, please record your vote on the amendment.
Motion carries 7-0.
We're now back on the amended motion to approve item F8, motion by Commissioner White, second by Commissioner Kemp and Commissioner Smith. Seeing no further discussion, please record your vote.
Motion carries 7-0.
Commissioner White, thank you very much. Mr. Merrill, sorry. Commissioner Kemp, you recognize. I'm sorry.
Thank you. I recognize that this has been a long day, but I think this is so significant and so important. And as I said, I'm very pleased that you brought this forward. But I thought everyone on the board and anyone who hasn't seen it should. I have a few of the stories. They were done by a reporter at ABC 10 News, Nicole Grigg, and I think it's really important for us to see what we've been doing in unincorporated county to children that are trying to walk to school. If you could just play those.
Our top story at 6:30, leaders now demanding crossing guards at every middle school in Hillsborough County after we uncovered some safety concerns.
ABC Action News reporter Lauren Rosella is outside one school with a plan to make this happen.
Yeah, parents here at Rogers Middle School are actually working to pay for their own private crossing guards out here, but you can see they already have a major problem. They can't do it because there's not even a crosswalk outside this school. So right now, Hillsborough County only pays for crossing guards outside of elementary schools, but you can see another major problem. Kids playing the game of Frogger across McMullen Road in Riverview. Parents at Rogers say they've been fighting for new sidewalks for 2 years. Now, while we were out here on Monday, county crews were out measuring. We're told the delay is trying to figure out who owns the land to put them in. So in the meantime, parents are left waiting. Commissioner Stacy White says he will ask the commission tomorrow to partner with the sheriff's office on a study to figure out how much a middle school crossing guard program will cost.
But you don't let her walk to school?
No way. Not across this road. Are you nuts?
And our children just have to hope for the best when they cross the road.
And now parents out here at Rogers Middle School are asking other families to go out and attend that commission meeting. They say that they need about 20 families. In Riverview, I'm Lauren Rosella, ABC Action News.
And
I thought there was a second story. Is there?
take a look at this picture here. It tells you everything you need to know. A car nearly hitting that kid. And so tonight, ABC Action News is driving Tampa Bay forward to get answers about what's now being done. Nicole Grigg with why parents are having to turn to their own fundraising just to keep their kids safe.
The cars don't stop.
Danielle Waymeyer.
Okay, make sure you look both ways, okay?
Is an extra set of eyes.
You're good. A child's going to get hit, and it's not worth it.
She even has photos of close calls at the crosswalk off Durant Road.
We have people who stop and literally will drive through our crosswalks while children are present.
She's begged for a crossing guard outside Mulrennan Middle School in Valrico, but she was told
there's not enough deputies or funding for our crossing guard program here for middle schools and high schools.
So now she's trying to raise money for a private company called the Crossing Guard Company.
It comes with a large price tag. We're talking $13,000.
This mom and others fundraising for change with a dodgeball tournament next week.
The little hashtag that we've come up with is dodgeball, not cars.
The sheriff's office tells us they're aware of the issues here, but they don't have crossing guards at middle schools because of funding.
And hopefully we reach our goal.
In Valrico, Nicole Grigg, ABC Action News.
I even saw a third story, which I guess wasn't here, where the reporter was amazing. She walked a route to school that the kids are using, and they required 10 feet at the side of the road for kids to walk along, and there was only 8 feet from the edge of the road to the fence, and the kids were walking in grass and ditches and everything else to get along there. It was bone chilling, absolutely, and I thought I would never in a million years allow my children to have walked that route to school. They would be in my car. I could have never allowed it. But I know everybody doesn't have access to the resources that I have or others have. And I just think no child in Hillsborough County should be subject to walking to school this way. In this case, we have an activist parent who brought this to the attention of the reporters. We have others that have some resources and attention at these schools, but otherwise, I wouldn't have known about this. Commissioner White may or may have or may not have known about this. But I'd like to make some additional motions because I just think we have to do so much more than just provide crossing guards. So I'd like to make a motion to direct staff to report back to us with a comprehensive policy for creating a 2-mile safety zone. By the way, the state of Florida only does not bus children that live within 2 miles of a school, provide for busing for them. So any child that lives 2 miles out is required to go along roads like this to schools. So this would be for creating a 2-mile safety zone around every school in unincorporated Hillsborough County, including complete streets, crosswalks, and every possible safety measure to make sure that this is an absolute top priority in our sales tax revenue moving forward to target all these schools in unincorporated county.
We have a motion by Commissioner Kemp, second by Commissioner Smith. Commissioner Overman, you recognize.
Thank you for bringing this forward. I'm curious if we couldn't actually include this in our land code as far as part of our comprehensive plan. Any school, honestly, any school that has any limitation on being able to deliver schools by school bus needs to have provision to make sure that children and parents that are choosing to walk their children to school or find any way to get to school, whether that be driving or otherwise, needs to have a safe environment to be able to get there. And since our county has adopted complete streets and health in all things, it would appear as though not only moving this motion forward, but ask staff to work with our planning and zoning folks to incorporate that in any future development of any school or communities that include a school, to incorporate this kind of standard to make sure that our children have an opportunity to get to their schools safely.
Just want to be clear, so you're asking that to apply to the school district? Or
To our
charter
land code when schools are being built, or
But to whom is the requirement going to apply? To the district, or to developers, or to charter school? I'm just not clear.
who develops school buildings?
School district.
Then maybe we should make a recommendation that the school district consider adopting that. Is that the protocol?
Yeah, because our land use code doesn't govern the school district. I mean, they build schools under state law, and frankly, we've had a lot of discussions with them that have not been fruitful about their responsibility to help pay for traffic concerns around schools. So we end up paying for it. They build the schools oblivious to the traffic impacts, and they have basically told us it's not their responsibility. So we don't control the school district, we control charter schools, but I think this is more about the school district. So I think, I'll defer to Christine and her staff, but I think it would be more a recommendation to the school district that they consider that. And since we're going to be bringing back to you soon the school impact fees, that might be an appropriate venue as you consider school impact fees to making requirements. If the school district wants impact fees to help them pay for schools, there ought to be a requirement as to how they use them. That's where you would have some control and influence, not the land use code.
Okay. I am going to recommend a working group to solve this problem within a very short period of time. I know that the school district members that I've spoken to find themselves also in a sort of frustrated situation. As a citizen and that has had to navigate among many partners of our government, recognize the challenge associated with, oh, that's not mine, that's yours, that's not mine, that's yours, and in this circumstance, we cannot afford to take that risk any longer. So if putting together or asking staff to put together a working group with the school district to find a solution in our land code that would require safety measures and Vision Zero standards for our school facilities, I would like to see that done. So however we do
members, be ever mindful, I've been a little lenient. Your comments have to be toward the motion. Okay? So just ever be ever mindful of that. I don't want to call you out of order. I don't want to be like the mean guy up here, but it's getting late, and we have to be mindful of that. Commissioner, did you want to close? Because I have Commissioner Merman next. Do you want to close last?
could do that. I was going to speak to some of that was said, but yes.
Okay, Commissioner Merman, you recognize.
I'm trying to take mine off.
Are you trying to take it off?
Yeah.
Okay, Commissioner. Okay, Commissioner Kemp.
Okay, I'll just, I do have a few other motions with regards to this, but the 2-mile safety zone where kids have to walk is really important. And to the part that is the school's responsibility, so be it, and we'll figure that out. To the part that I'm sure is certain is the county's responsibility within that too, because the school doesn't go out for 2 miles, then I think we need to take responsibility for that. But I think we need to move forward with this expeditiously and as a priority, because I think that it's shocking to see that we've put the children in this position in unincorporated county. And I'll add that yesterday I spoke about this at the MPO meeting.
You're going to talk yourself out of vote.
I'm sorry?
Go ahead.
Well, Mayor Lott came up to me of Plant City afterwards, and he didn't say that they had a 2-mile, but he did say that they actually raised taxes in Plant City by 1 mil only to do school safety projects, and that every school in Plant City has a protective zone of some sort around it. I think 2 miles because of the bus, but we can go to a vote. I think this is extremely important.
You have a motion by Commissioner Kemp, second by Commissioner Smith. Seeing no further discussion, please record your vote.
Motion carries 6-0.
Commissioner Kemp, you recognized.
Thank you. I have another motion. This may go, Commissioner Overman, to more of what you were considering and more of Mr. Merrill's concerns. A motion for a joint school board and BOCC meeting to consider and address concerns, issues of mutual concern. By the way, we did this back in some 2004, at least when I was an aide for Commissioner Castor at the time. And issues of mutual concern, including school safety, infrastructure, mobility fees, and school sidings, to see if we can't have some discussion with the school board and look at our areas of mutual concern.
We have a motion by Commissioner Kemp, second by Commissioner White. Commissioner White, you recognize.
Yes, Mr. Merrill, I haven't noticed that we've had one of those joint meetings with the school board lately that was sponsored by the Tampa Chamber.
It's been a while, yeah. I think they were quarterly.
You think you could get the Tampa Chamber to put one on like they traditionally have, and we can make this the topic?
Sure, yeah.
Okay, great. And
Okay, we have a motion by Commissioner Kemp, second by Commissioner White. I see no further discussion. Please record your vote.
Motion carries 6-0.
Commissioner Kemp, you recognize.
Thank you. I'd also like to authorize for us to add to our legislative agenda that we ask our legislature to provide funding for busing from the 2-mile to the 1 mile for every student that lives within just over 1 mile that they are provided busing to their respective schools.
There's a motion by Commissioner Kemp,
I'll second it.
second by Commissioner White.
I know it's a long shot.
That's dead on arrival.
I think we should start, right. But we need to start letting them know.
Okay. Okay, we have a motion by Commissioner Kemp, second by Commissioner White, to ask the legislature to fund 2 mile, repeat your
1
motion.
mile.
1 mile.
Within 1 mile to students outside of a 1 mile line.
2 when she wants the lesson at the
To 1,
Okay, yeah,
right.
okay. All right, good luck. Seeing no further discussion, please record your vote.
No harm in that.
No harm in asking.
Motion carries 6-0.
You through, Commissioner Kemp?
I am through.
Okay. Mr. Merrill?
Okay, that leaves G1, which is Children's Services remedies to the audit for child care licensing.
Good late afternoon.
Good afternoon. Thank you. My name is Joanne Rollins. I'm the Department Director for Children's Services. And standing next to me is Ms. Angela Chowning. She's the Program Manager for our Child Care Licensing Program. We're here today to discuss the response and remedies for the Clerk of Court's audit. Report number 00, your files may reference report number 357. The objective of the audit was to determine whether or not the child care licensing program had adequate controls in place for licensing and inspections for child care centers and homes. The auditor's opinion stated that the overall environment of the child care licensing processes were at a formal, defined maturity level, and control awareness did exist, and policies were well-defined and in place. However, the audit provided a set of recommendations in this report they believed would enhance the overall control structure and provide increased consistencies and assurances. The audit provided 2 major comments. Each comment focused on the opportunity to improve controls. One comment, comment number 1, focused on 4 areas: license issuance controls, license fee collection, verification of DCF background screenings, and license fee waivers. The second comment focused on the opportunity to improve controls and inspections, specifically the criteria for the number of inspections per year. The audit detailed recommendations for each comment section. Program Manager Angela Chowning is considered the subject matter expert. She will explain in detail each recommendation, its implications, and provide the remedies.
Thank you. The recommendations for comment 1 are administrative in nature and will enhance the existing processes. I have additional information to provide to you for slides, for recommendations, 2, 3, 4, and 10, which we thought may have been of particular concern for the board. On this particular slide, the first recommendation referenced the documentation of late fee waivers. Number 5 ensured dual signatures obtained in our approval paths when we approve a license. 6 was to train additional employees as a backup for deposit tasks and preparation of those reports. Separate the tasks of opening the mail, logging checks, and preparing the deposit between clerical staff. Implementing a more reliable method of redacting information in the provider files, and to record overpayments in the public record file and to return those overpayments to the providers. Audit recommendations 2, 3, and 4 pertain to our level 2 background screenings that are conducted for child care providers. For clarity, child care licensing does not process those background screenings in-house. The providers go to an outside vendor, and those results are entered into the DCF background screening clearinghouse. The role of child care licensing is only to verify those results. Initial licenses are never issued without this verification, and when we renew a license, we verify this as well through our ongoing inspections and on our forms that we have in-house. As a result of this audit, we did get some counsel from the county attorney's office, and we were told that we did not have to retain those documents. We started retaining them for whatever reason, but we were told that we do not have to do that. So we're going to be discontinuing that process. We do have the virtual way to verify those background screenings through the clearinghouse. Audit recommendation number 10 was of some concern because we accepted the risk for this. Please note that children were not at risk, but rather CCL is using an older version of our record management system that's being phased out. And to be proactive, in 2017, Child Care Licensing identified and vetted a vendor that would be able to replace that system. And we're currently working with IIO to purchase that and implement that hopefully October 2019. Audit comment 2 pertains to the controls over the inspection processes. We are mandated by the state to conduct 2 inspections per year. However, we intentionally exceed that practice by doing 3 inspections per year, just to enhance the required oversight. And in some instances, providers can qualify for 2 if they have a good compliance history. The auditors did not find that we had a written procedure in the family child care home unit that established that criteria. So we've since implemented that. Our corrective actions, we have new policies that have been created and reviewed for many of the recommendations, 1, 2, 5, 6, 7, 8, 9, and 11, to be specific. And those went into effect February 1st. They've been given to you in your packets that we just distributed to you. Based on the county attorney's research, there's no requirement to retain the background screening pieces of paper on, in-house, so we will be doing that through the clearinghouse and ceasing the retention of those documents. Both ordinances have been updated and will be presented to the board in the coming weeks. And then hopefully our new record management system and software installation will begin in October.
Ma'am, can I get your name for the record, please?
My name is Angela Chowning, Child Care Licensing Manager.
Thank you.
This completes the audit recommendations and remedy portion of our presentation. For the benefit of the new board members, the next slides are a brief overview of the program, structure, and services. Licensing Care Services was established in 1977. We are one of five local licensing agencies in the state of Florida. Palm Beach, Pinellas, Sarasota, and Broward are the other four, my apologies. We receive annual fundings from 3 different sources: the Early Learning Coalition, Department of Children and Families, and the Board of County Commissioners. The funding from the Board of County Commissioners equate to approximately 15% of our budget. We also provide services that impact over 57,000 children and their families in Hillsborough County. We do this through 527 licensed child care centers, 559 family care homes, and this is accomplished by 19 staff members.
In fiscal year 17 and 18, we conducted 4,119 health and safety inspections, investigated 338 complaints of potential health and safety violations. We provided over 8,000 instances of technical assistance to providers and parents, 35 consultation courses for new child care providers, and 33 child care provider workshops on health and safety topics and other early childhood topics. Additionally, in 2018, we were audited by 2 of our funders, the Department of Children and Families and the Early Learning Coalition, and received 100% compliance on both. We're excited about this new grant opportunity that we've been given in addition to our responsibilities. Beginning in October 2018, we were funded by the Children's Board in collaboration with HCC to provide on-site coaching to 200 child care centers and homes, to provide community-wide workshops on early childhood topics to 800 unduplicated participants, and to offer continuing education units. At the time that we put this presentation together, we had 80 child care centers registered for on-site coaching and had conducted 5 community-wide workshops. And since then, we have over 100 providers signed up for on-site coaching from our staff and have conducted 7 community-wide workshops.
This concludes the presentation. Thank you for your time, and we'd like to thank the Clerk of Court's auditors for their recommendations. We welcome any feedback and any recommendations that would allow us to better serve our community. We're open for any questions at this time.
Thank you for your presentation. We appreciate that. Commissioner Merman, you recognize.
Thank you, Mr. Chair, and just to kind of let everybody know the reason I asked them to bring this report back, I was very concerned about the concerns of the auditor, especially the one where it said opportunity to improve controls over inspections. I just think it's very important that we stay focused on why we are doing childcare licensing separately and not giving it back to the department. I mean, I think we have to justify that. And if it's to give, as I think we said, an extra layer of oversight and better quality, then when an audit comes back with 11 recommendations, we need to step up our game. Would you all not agree?
Yes, ma'am.
We agree.
So it's not to call you out or do anything like that. I just want to make sure, because I know if we have an accident in one of our childcare homes, we're responsible. And what do you think the newspaper is going to do? I don't govern my life by headlines, but sometimes this particular situation would be a traumatic headline for us going forward. And I think that the understanding the board, what the difference is and what DCF requires and what we require, and what's the difference? What's that extra layer of quality and that we all want you all to do? Because I think you do a great job. It's just, it's process, it's, we have to justify, we have demands on us in our budget. And no one wants to put children at risk, no one. But we got to make sure if we're paying for extra, we get extra. And I think that's my, my whole thing with this is let's just step up our game and really keep doing that extra layer of quality and go forward. So I'll move to accept the recommendations.
A motion by Commissioner Merman. Second by Commissioner Kemp and Commissioner Smith. Commissioner Overman, you recognize.
Thank you. Commissioner Merman, thank you for making sure that we are doing the job that we ask everyone to do to protect our children. What's really fabulous about your response is that you came back with, concrete recommendations of the things that our system found. And then in your other two analysis, it came back 100% compliant, and yet we had 11 recommendations to consider. That says, volumes about the standard of doing things in the best way possible. I truly believe that if we're going to outsource some things that we have, as we do with licensing in some cases, that we have accountability factors to make sure we're doing it well. And I commend you for the recommendations, for doing the analysis in a thorough way and then responding accordingly. And thank you for the report. It was very helpful to understand.
Thank you.
We have a motion by Commissioner Merman, second by Commissioner Kemp and Smith. Seeing no further discussion, please record your vote.
Motion carries 6-0.
Thank you.
Thanks very much. That leaves your last item, which is G2, the routine report from Head Start.
Good afternoon. My name is Brenda Mount, M-O-U-N-T. I'm the manager for health and nutrition for the Head Start Early Head Start program. I'm before you today to represent Dr. Jacqueline Jenkins, our director. She's attending the Region 4 conference. I'm asking for your acceptance for our December 2018 report. I'm going to just briefly highlight a couple of things that we did during the month of December. We participated in the Dream Center of Tampa Bay Health and Wellness Fair, and we have also reached our 10% of children with disabilities in our program, which is a Head Start requirement. And during the month of December, we served 52,984 meals to our children. Thank you.
Thank you very much for that. Is there a motion to accept the report?
So moved.
There's a motion by Commissioner Merman, second by Commissioner Overman to accept G2. Seeing no further discussion, please record your vote.
Motion carries 6-0.
Ms. Mount, thank you.
Thank you.
And that just leaves future discussion items, if any.
Commissioner, okay. Commissioner White, you recognize.
Thank you, Mr. Chairman. There was a gentleman this morning that spoke on behalf of the firefighters union, and he expressed a desire to begin taking at least small steps towards addressing our backlog of building needed fire stations. I think aspiring to build and operate at least one station per year is a reasonable goal. Mr. Merrill, at my urging, a study of fire rescue impact fees was conducted some time ago. I know that was reviewed with me in a one-on-one briefing, but I don't remember the study in and of itself being formally presented to the board. Did that ever happen?
No, we're going to bring it forward as part of the budget process, along with the master plan that was done last year for fire rescue facilities.
I think in understanding that wanting to at least take small steps, even outside of the context of the master plan, certainly we would be talking about needed stations that are addressed within the master plan, but I think we can, where we can, seek to take small steps outside of that broader context. So, as I've said, I was briefed on the study. It definitely suggests that fire impact fees can be raised. So what I would ask is that at the next meeting, that staff schedule a staff item, that there's a staff item scheduled to review this impact fee study with the board and have a broader discussion on how we might begin taking at least small steps towards getting these stations built.
Let me ask a question concerning that, Mr. Merrill. You and I had a discussion on this. You told me that this is something that you're going to bring forth through the budgetary process. Am I correct?
Yes.
So we can't wait to the budgetary process to bring this forth?
We have a couple of new members that, that may not have known about that study. I mean, it happened over the course of one meeting. I know that you were busy on the campaign trail, even though you were following the issues of the county commission. I don't know that exact issue showed up on your radar screen. So I think this is a golden opportunity to just have it formally presented to the board at a public meeting now and let the new members lay eyes on it and just begin to have some conversations. If the board ultimately decides to just defer, to the budget deliberations, that would be fine. But I think we should at least get it out there and look at it and just start these discussions. So if the board concurs, if there's consensus, I'd like to have that item as described at the next
There's
meeting.
no consensus on future items. You asked Mr. Merrill to have it here, he'll have it here.
Okay.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. I have been getting increasingly worried about Sims Road. I think I've talked to you and staff about this.
what, ma'am?
And
Sims Road.
Sims
Sims
Road, it's becoming a hot spot. It's the new and upcoming Big Ben problem. I don't sit on MPO anymore, but I'd like for our staff to work with the MPO to see how we can get Sims Road on the LRTP.
Okay. We can do that, although we probably have a faster way to address it through our transportation plan.
That's fine too.
Unless
Whatever
there's-
way possible is.
Unless there's something in particular about the LRPT that you're thinking would be.
Well, I was thinking about the surtax, if it goes through, if it's not on that list, the
It doesn't
LRTP.
It doesn't have to be on the LRTP.
So it will come out of our funds. Okay.
Yeah, so the process is that each jurisdiction develops their transportation plan independently of the LRTP, and the plans go
Okay.
to the oversight committee. So we have a workshop on February 21st on the transportation surtax where we're going to present projects. So we will make sure that there's something in there for Sims Road.
Very
So,
good.
yeah.
They are looking at right now, they're doing the assessment of the intersections and see if they can make some short-term improvements. But overall, and I know the culverts are big, it's a huge expensive, it's much more expensive than I think even Big Ben would be because of the culvert issues and moving pipes and all kinds of stuff. The other one was to see if Pet Resources can work with Children's Services about bringing pets to Lake Mag to help as therapy for some of the kids. I don't know if it's possible, but I know that child abuse victims react real positively to pets, and some of them have abused pets actually, as kind of displaying their abuse. But I've been reading a lot of articles about that, and I don't know if it's possible. Maybe our partnership with Humane Society, if it's something they can do. I just wanted you to look
Sure.
into it.
Yeah, we'll look into it.
Thank you.
Commissioner Smith, you're recognized.
Thank you. I would like to request that before our staff begins the resurfacing of Bay to Bay, which is scheduled for this month, that staff bring back at our next board meeting on February 20th an item on the final design of Bay to Bay for one last review. That's my item. I'm, of course, concerned about the...
Can I comment? Oh, maybe I won't.
Yeah.
We've been around this,
I know there's been board discussion about this. but
not just board discussion, a lot of board discussion.
And I understand that, but I also know that the community has had ongoing discussions, and I'm hearing from the several constituents there that there might be some way to reach a consensus or a compromise. Of course, the goal is to see if we can incorporate more safety features for cyclists and pedestrians on that road. I think it's worth one last look before we spend taxpayer dollars to pave the road in a way that would, when there might be options for adding more safety features to it.
Okay.
We will have 1,000 people sitting out here. It'll be David versus Goliath.
Let them come.
And the mayor may be in the front row.
Commissioner Overman, he needs to come. Commissioner Overman, you recognize.
Thank you. As it relates to Commissioner Smith's comments, I know I've gotten some emails regarding removal of some crosswalks in that area as a possible design result. So that's why I think that's maybe needs a little bit of redress. But actually, I wanted to ask staff, and this relates to Commissioner White's request regarding issue on our first responders and fire rescue issues. I'm just curious, have we recently done a best practices study among other communities that have experienced high rapid growth to ensure that our safe and time-sensitive levels of service by first responders, particularly our fire rescue, their concerns are being addressed? I mean, we can't be the only community in the country that is dealing with this struggle. And I'd love to get a report from staff in partnership, with fire rescue as well as emergency response, to identify best practices. Clearly, we need more stations, but clearly we also can probably adopt some things to get us to the point where we can afford to do that. And I don't want to put anybody's life at risk. I don't want our fire rescue personnel to be at risk. And I certainly don't want any of our citizens at risk either. So I just don't know if we've already had this done, but I would love to see a study of best practices by growing communities and how they've addressed, there's always a lag to get where we need to go. And I'd love to see if there's been any analysis in that respect.
Yes, we did a complete master plan for fire rescue facilities and presented it last year. We were planning on presenting it again. It was done by a reputable independent consultant.
And it listed best practices that have been adopted by other communities that faced what we are facing?
I don't know if they specifically looked or listed them, but part of the study was to look at what we do now, what we can do better, and how to get there. So and it resulted in recommendations for constructing new fire facilities, for dealing with existing facilities. So it was a complete top-to-bottom master plan that we'll bring back to you all.
Okay, great. Could I see the old version before we see the new version?
We're not going to redo it. It's not that old. It's
No,
only
okay,
a year old. We'll give you a copy of the...
Okay, thank you.
Probably, I should just have staff come and meet with you and walk you through it and give you a copy.
Great. Thank you very much.
Sure.
I appreciate it.
Commissioner White, you recognize.
Thank you. And regarding Sims Road, another thing that it has in common with Big Bend and Gibsonton Drive is that part of it's in your district and part of it's in my district. Look, I know you have to be incredibly careful about what you say in these public meetings because, you can send shockwaves. So, I want to be, careful here in saying that this is just rumor at this point. But I think it's a question, though, that has to be answered. I've heard on a couple of occasions rumors that FDOT might at some point be interested in an interchange at Sims Road. I've not been able to run down whether or not that's fact or fiction, but I think as we're looking at what we need to do with Sims Road as a county, I think we do need some finality on whether or not there's an interchange envisioned there, even within the next 10 to 20 years. We might as well make sure that any plans are cohesive. If it's fiction and not fact, then so be it. Then we just, do what we need to do. But I think that question should be answered as part of that process.
Okay. This is not a future item, but I'm going to say it anyway because I got the microphone and I'm the chair. Last night, our affordable housing staff, Ms. Howell, had a forum. And when I drove up, I thought we were giving away food. There were so many people there. I was totally shocked. There was over 200 people there. And I know there was because the technique that they had for people to vote on questions, I know that a couple of answers were over 200 people that had responded to them. And the questions they asked I thought were very pertinent. We're going to see those results of those questions and the whole comment that I didn't say this, Commissioner, I kept you to come in. I'm going to make this short. They're going to bring back their report on the 20th of this month, but we'll wait to see that. But I just want to comment and say they did a fantastic job. There were some people at the very end that had some negative comments to say, but that's those people. I know them and they do that all the time. But they did a fantastic job, and they're to be commended. I also want to tell you that, Mr. Merrill, that the work that she did to get that many people out there, and I mean they were from all walks of life. They really, really were, and they're just outstanding. So I just wanted to let you know that. Commissioner Kemp, you're recognized.
Thank you. I just wanted to thank you for, thank you, Ms. Howell. I thought I've never seen anything quite like it. The room was filled to capacity. And it was a really incredible job with community engagement like I've never seen. So, again, I'd just like to commend Ms. Howell for going forward, and I'm looking forward to us moving forward in affordable housing.
Seeing nothing else, we'll adjourn.